were given the opportunity to take nursing students overseas to have an observational placement in our hospital in India, and we chose the MS Rama Hospital in Bangalore in India.
The chance to go to India and to experience India as a country and to see part of their healthcare system and to relate it back to my own course was just phenomenal, and I never would have got to India without this research project and the privilege that that kind of brought with that. But being able to relate it back to everything that I do as a student nurse and everything that we do as part of our course and part of our NHS and part of my future career was just too good an opportunity to kind of pass up.
When we went to India, it wasn't so much poverty. It was more everybody had everything they needed, but it was on a much lesser scale than the UK, both from a personal perspective and also from a medically driven perspective, from a hospital clinical perspective.
Each day they were exposed to a different area of practice where, although only able to observe, exposed them to a complete and utter different way of delivering care. The second 2 weeks of placement, we were fortunate enough to place students in Kaiwara, where MS Rama had organised multi-speciality, what they called a winter school, which effectively was a public health school for their medical school and students of allied health professionals and nurses. So in total, around 400 students had interdisciplinary learning and were able to visit local villages, receive lectures, discuss the Indian public health agenda, and to address and be absorbed into Indian culture within village life.
I think in Britain, I think I'm spoilt because everything that I need is at my fingertips, and I can get on a bus, I can walk, I can go anywhere, and everything that I need is there. And even if it was something, you know, the resources and internet and I don't know, whatever else, everything that we need and more besides is here. And so you take that for granted and you think that you need things that you don't really. And then we went to Kaiwara and saw people, you know, going out every day to collect the water. And I don't need to do that, and that was something that they were happy to do, and this is what is part of their daily life. And all I've got to do is turn on a tap. So it's as basic as things that, you know, we take so much for granted here, that it provided for us, that is there, that if I need to go to the doctors, it's there for me. I might have issues getting an appointment, but there is an NHS that is free at the point of care for me. In India, those kind of resources are very different.
In the rural setting, there are many different ways of looking at it. From a village setting, we had a CHC, which was a little like rural health centre. Again, limited resources, they just basically could monitor you while they got you to a more clinical setting. The more clinical setting was called a PHC.
This is their X-ray department, which looks fairly basic and quite old-fashioned really. That's like a portable X-ray machine there.
Now, out of all the places I went to in India, I wasn't shocked by anything apart from that, what you call PHC setting, which is a bit like a local community hospital with 100 beds. But I walked around there and just the whole place, the actual, the hygiene, it was supposed to have operating theatres and it's got consultants there and people like that. I did actually take a video of one room just by chance I was walking past, and I found out later, once I'd done a quick video of it, it was called a poison room, which was quite frightening. It was a room that looked like a disused room in a 1974 industrial building, and basically they put people in there to do the stomach pump. and on the bed, it was a rusty bed with just a funnel and a hose pipe, and that was the treatment, and a big pit and a massive ceiling, which that was the worst bit I saw in the whole 4 weeks of what I was in India.
So what we're doing here then, Matt?
Well, we're planting several saplings as part of an activity that they call Shram Down. This is basically a way of saying thank you to the villagers for opening their arms to us and inviting us into their homes and showing us how they live over the last week or so.
I put my name down in English, and they've written their name down in either the native language, Canada, or even written the name in English. So that's all the kids,
Suwarna.
all these boys.
Pleased to meet you, Suwarna. I'm Matt.
They're very keen to write.
My name is
We're being filmed.
To be exposed to a low income country where service provision is very different, with very limited resources, completely exposed the students to an entirely different way of care delivery. So most of the students embrace this as important learning, not particularly because of the clinical skills that they use, but about service provision in an entirely different way.
I just think, you know, something like this, if you've never travelled abroad like me, it's a huge opportunity. It's when you get there, it's a great experience. You can never take the experience away from you. I've had a really good experience while I was there. Nothing really fazed me that much. I just think if you get the opportunity, go for it, you know.
If you've got the chance to go and to visit another country and be part of everything that they've got to offer you, especially as part of a healthcare degree where you get the privileged position of going and being part of somebody else's healthcare system and being able to bring that back to your own life and your own career and our own facilities and our patients, then do it. Don't hesitate, just do it. It was the best thing.